To Bethesda, Maryland now, where Trump is participating in a roundtable briefing on coronavirus at the National Institutes of Health. It's live. Let's listen in.
We always turn to this team to do that. And it's really something that we feel that we're proud of, but I think the nation should know that these are the kind of things that we have available for them. John, you want to?
I would just like to also welcome you, Mr. President, Mr. Secretary,
Thank you, Jim.
to our Vaccine Research Center. We look forward to a brief tour for you upstairs where you can have Dr. Corbett and Dr. Graham tell you about how we're working on the coronavirus vaccine.
Right.
Good.
Just to give you a comparison, because we always talk about SARS and we always talk about MERS and things like that. If we could have just go through the slide. I just want to go to the next slide. This is an article that I wrote a little while ago, and I called it Coronavirus Infections More Than the Common Cold. The reason is, up until recently, coronaviruses were like mild things. They were just common cold. Just next slide. In fact, those are all different kinds of viruses. The ones with the red circle around them are the 4 viruses that cause the common cold. That was until 2002. Then we got a big surprise, and the surprise was is that we had the severe acute respiratory syndrome, and that was SARS. Multiple years later, we got the Middle East respiratory syndrome. But a story that you may remember, next slide. In China, in the Guangdong province, the sort of history repeats itself,
Right.
Mr. President.
Right.
In China, in the Guangdong province, there was this strange disease that came up that nobody knew what it was. The Chinese didn't really tell anybody about it for a few months, November until it got to Hong Kong. When it got to Hong Kong, next slide, in a hotel in Hong Kong, and this was way back in 2003, someone from China went to the hotel, infected a bunch of people, next slide. And this is what you had. You had flights going. At the time, we didn't make any restrictions the way you did, which I think saved us a really lot of hurt. Next slide. And then this is what happened. There were 8,000 cases, 774 deaths. And that's how I get the number that I've been telling you, that the mortality of SARS was about 9 to 10%. If you do that math, that's what it is.
Wow.
Right. Next slide. The other one is the MERS coronavirus, which was the one that was in Saudi Arabia. That was also from an animal reservoir. Next. In fact, it was from a bat. Next. From a bat to a camel, and then for the people in the Middle East who got it, that was the infection there. So these are the kind of things that go from an animal reservoir to a human. Sometimes it doesn't go anywhere. It just goes 1 or 2 people. But sometimes it adapts itself to function very, very, very efficiently. Next. And that's what happened. We had MERS coronavirus in Saudi Arabia. We had a few cases in the United States, but not many. And finally, next. This is where we are right now with the coronavirus. And then just getting back to the last, we got this sequence about a week after the Chinese were able to put it up on the board. And next. And then these are the things that we do, therapeutics, vaccines. So we'll stop there, but we'd really like to hear some comments from you, Mr. President, if you want to.
Well, I want to thank you all. This is incredible, and I've heard about you, and I know all of you by name, and now I get to meet you. Unfortunately, I get to meet you because we're talking about this, but we've made tremendous progress. I know you're dealing with other nations to help them out because they really, they got hit, some of them very badly, and we're talking to them also, and we're making decisions as to whether or not we're allowed to travel. They're allowed to travel. We've been pretty severe on those restrictions, but I guess we did the right thing by being severe. NIH is the home of, I see so many different factors, and it's true, the greatest doctors. I've heard that for so long. I heard that from my uncle, Dr. John Trump. Big fan of what you've done and how it started, and it's really been an incredible situation. But the scientists and researchers all over the world, they say this is the best there is. And I think the world is extremely happy that you're involved. And Tony, your reputation is second to none. I think we all agree with that. You have to agree with that, John, right? And you have no choice.
Indeed, sir.
But the fact is, it is, in this case, it's true. And we're very lucky to have you. I will say that the vice president is over on the Hill. He's just leaving now, and I told him to stay there. And finish it up, but we're doing very well in terms of getting the funding we need, the necessary funding. And I asked for X, and they want to give us more than X, and that's okay as far as I'm concerned in this case, Francis. That's unusual, but that's okay. But I just want to thank everybody at NIH and all of the great scientists and doctors and everything. I know you're working around the clock. I know you've made some great finds already, and that's really makes us feel very good. We had some good meetings yesterday with the companies that I guess you ultimately would go to the companies. You'd have to go to the companies. So we had Pfizer and Johnson & Johnson and some of the other great companies, and they were very positive as to the outcome. And therapeutics were a very big thing, because I guess therapeutics can happen faster than the actual vaccine, and certainly the result can happen a lot faster. So we're looking for some good answers. But I just want to thank you very much, Tony, and we really appreciate it. And John, thank you. Thank you very much. Fantastic job. Thank you very much. Great to have you. And you don't have to shake hands with him. I see him every day, so I don't have to bother. So thank you all very much. Great job. Appreciate it.
Mr. President, can you travel to Japan or Italy right now?
Well, I haven't been asked to, but I think we're making decisions on certain parts of those countries, as you know. We've already made a decision on parts of Italy, and Japan is very unfortunate because I've seen the incredible job they did on the Olympics. As you know, they're building.
You've been listening to President Trump there give an update on the coronavirus outbreak. Hi, everyone. I'm Rena Nine, and thank